Hi, it's Dr. Ian Billinghurst here. I'm your host for the Raw Dog Food Summit, and I'm really excited this morning to have our kickoff party. Not a drop of wine in sight, but nevertheless, it's a kickoff party, and you're all here, I hope, and we're really pleased to see you. I've got three of our panelists for the Raw Dog Food Summit, and we're going to be chatting to them today and talking about their topics. So I want you to get excited, because you should be excited. This is the most important summit there could possibly be. And we were having a chat before this summit, or before this party started, and talking about a decline in interest in, well, holistic veterinary medicine. And you know why? Because raw food is on the increase. And if you have raw food, you cut out the need for everything else. Isn't that brilliant? And you think I'm joking? No, I'm not. I actually know that to be a fact, because food is the king of all medicines. And Hippocrates said that a long time ago. So without further ado, let us introduce our three speakers. First of all, we have Dr. Katie Woodley. Now, Dr. Katie Woodley is the proud owner and holistic veterinarian of the Natural Pet Doctor. Now, her mission is to ensure that all pet parents have access to herbal medicine, access to supplementation, and most importantly, nutritional advice. Now, they need all of this, particularly the nutritional advice, throughout their pet's lifetime to ensure those pets not only survive, but thrive. So, Dr. Katie, if you could give our audience and our fellow party members who possibly have drinks a wave.
Hey everyone, I'm excited to be here.
Next we have Ronnie Lejeune. Now Ronnie is the lead certified canine nutritionist, a brilliant young lady at this, I might add, and the owner of Perfectly Rawsome, which is the online resource for fresh food diets, and it's a great resource. Now she's also a certified professional dog trainer, something I'm not very good at. So it's wonderful to have somebody here who can do this sort of thing. And she's a trainer at Optimal Canine, where her focus is obedience, sports performance, and fitness training. So Ronnie, could you give our party members a wave?
Hey everyone, thanks for having me.
Now, last but not least is the man who just has a problem with words, never can get a single word out. His name is Dr. Connor Brady. He's Irish. And it's late at night, but I can assure you he will be chatting. Dr. Connor is the founder and owner of Dogs First, that is. And I think that's the way you're supposed to say that. And the author of one of the top rated raw food books, Feeding Dogs, Dry or Raw. What a great question. I know the answer. I think most people here do as well. Dr. Connor is a dedicated advocate for natural canine feeding, a mate of mine in that area, and canine feeding and health through raw feeding. So, Dr. Connor, if you could just give our fellow party members a wave.
Hi everyone, thanks for having me. I'm delighted to be here.
I think it's easy to recognise who Dr. Connor is. He's the other male in this group. Now, why should we be feeding raw? My goodness, I think the answer to this question, it's so important, is very simple, because it's the healthiest diet possible. It is, in fact, if done properly, and this is important, if it's done properly, it is the gold standard way to feed your dog. And why wouldn't you feed your dog that way? This is the way to feed your dog. But what is raw? It's a great acronym. It's restoring animal wellness, and that's great, because animals that, in my experience, if they're fed processed pet food, you put them on raw, properly done, they return to health, almost no matter what the condition. It is, in fact, the king, the queen, the emperor, the monarch of all medicines, and it's the same ditto for feeding. So terribly important to feed raw. But what is raw? Is it just raw meat? No. And that's that's the problem. And lots of veterinarians believe that's to be the case. Of course it's not. Raw is feeding dogs the diet they evolved to require. So it's the evolutionary diet. That's what raw means. So get that, you've got to get that into your head. And we're going to be talking about that both in the Raw Summit and in the post summit course that we will be offering as well. But it's most important you understand that raw is what dogs evolve to require. So that's where you have to think of it in that sense. And it's a bit like saying, well, if I've got a car, I'm going to put in the right spare parts, the right oil, and the right fuel, the ones the manufacturer recommended. And that's what raw is all about. Our dogs did not evolve eating processed pet food, and that is for sure. And this is the reason, this is the prime reason that veterinarians exist today in such large numbers on almost every corner, because they have an enormous job to do fixing up the problems caused by raw food. Caused by processed food, fixing up those problems. Now, what most of them don't understand is that they could do a much better job if they simply switched their patients to a properly formulated raw food diet. And that's what this summit's about. But today we have three brilliant speakers, each with their own slant on raw and each with a vast store of knowledge they're going to share with you. So we're going to ask each speaker, and Dr. Connie, you've got only 5 minutes for this, to explain what you're going to be talking about. But I'm not going to start with you because we may never get to an end of it. So I've got to give Dr. Connor a hard time. We may not get to the end of it. We're going to start off with Dr. Katie Woodley. Can you tell us what you're going to be talking about today in the Raw Summit and what people can look forward to hearing from you?
Yeah, so my presentation that I give during the summit is all about raw feeding for puppies. So for growth stages and how to make sure, talking about the balance and how to do that appropriately so you don't cause any harm. And so what I talk about is a little bit about the benefits of raw feeding. We talk about like when and how to like transition to a raw food diet if you're not currently feeding a raw food diet and you have a puppy. Then also we talk about how to get started, because that can be a scary process for a lot of pet parents, especially if you're new to this and you may not have a veterinarian who agrees with raw feeding. So you'll get some tools and like ratios and all sorts of ways to help guide you. And then I finish with talking about safe raw meaty bones for puppies that you can utilize to get them started. So it's kind of a guide through the whole entire presentation that you'll be able to refer back to get the information that you need to get your pets, your dogs on the right path from day one when you get them as puppies, so you can start feeding them the best diet possible for life.
Wow. Now that's just so important, everybody out there. You've got to attend, you've got to listen to this, because a lot of people think, firstly, that you can't feed puppies raw. My goodness, what have they been doing for the last how many millions of years? But that's their ancestors, that is. And the other thing is, a lot of people don't know how to do it. So let's make sure you listen to this important talk. Getting your dog started on the right diet sets them up for a lifetime of health. Ronnie, can I get you now to chat about what you're going to talk about? And I know you'll fit in with that 5-minute limit. Thank you.
So the discussion I had with Ian was focused on sport performance dogs and how we feed those dogs to maintain and achieve optimal performance. And we covered many things from protein, fat, and antioxidants that we could ensure that's in the diet, that's nice and enriched diet to make sure that we can achieve optimal performance that layers in with the right training and conditioning protocols to achieve that canine athlete.
Wow, that is going to be fabulous. And I know it is fabulous, actually, because I learned so much talking to Ronnie. And that's so, and really, if you think about it, every dog is a performance dog in some way or another. So what Ronnie has to say actually applies to every dog out there, because your dog gets out in the park and runs. At least I certainly hope your dog is doing that, because exercise is so important to health. Getting that oxygen in, getting those muscles and joints working. You know the old story, if you don't use it, you will lose it. Now, Connor, what are you going to be talking about at this conference? And I don't want the whole talk, just a summary, mate, if you could.
We will be discussing, I was going to give you a smart answer there and just say
protein,
fat, and carbs, and then just stop talking, but I can't stop talking. we're going to do.
Actually, let me interrupt here, please. You go ahead and you say for as long as you like, because we love to hear you talk and we love your Irish accent. Go for it, mate.
We're doing protein, carbs, and fat. Protein, carbs, and fats. Like, you know, macronutrients, the things we see on the front of packets. It's so, people think it's so important to be talking about things like, you know, it's kind of, food has gone from, you know, eating meat and veg and eggs and dairy, and now it's gone down to protein, fat, and carbs. So I'm actually very reluctant to go really far down into the kind of amino acids and molecular level, because people are so confused. They've got PTSD about feeding their dogs, and they think if I don't get the exact fractions and ratios of these right, he's going to walk around with a limp on a Tuesday, you know. So I think we talk about protein, how much, like, you know, where does a dog normally get his protein? How much would they eat when they're left to their own devices out in the wild? What protein is, what it does for you, what's good protein, what's bad protein, and comparing the two types in dry and raw food. The carbohydrates, then, once you understand that the dog is a protein eating machine, you look at the high carbohydrate diets they're being fed and think, how is this working out for dogs? And we've got this raging obesity crisis, diabetes spiking, particularly in cats. We've got pancreatitis, cancer. All these issues we know are linked to high carbohydrate diets. So we tease that apart in our chat and kind of explain where these diseases are coming from and what the studies tell us is the solution, which won't surprise you, is the very opposite to feeding these high carbohydrate diets. And then fats are interesting. You know, fat has a bad rep, but, you know, good quality fat is just so good for you, so important. We talk about good fats, we talk about bad fats, and we give you a couple of tips and tricks for, you know, be careful with your fish oils and your green lip mussels and whatnot. There's goods and there's bads in all that. So the good, the bad, and the ugly of fat as well. So we cover the three in a good hour.
Absolutely, well done. Thank you, Connor. And this topic is so important. And you mentioned something, and I don't know whether everybody picked up on it, but you were stressing the importance of looking at the foods we feed and not worrying about so much the so-called nutrients, because if you feed the right foods, you get the nutrients right. And that is so important. And that's something you've just mentioned ever so briefly in there. And I want to pick up on that. So this is a very important, we had a great discussion, Connor and I think we went over time. I got wrapped over the knuckles for that. And I really had to go and you should say, no, it's not my fault, it's Connor's fault. But anyway, if we could shift the blame to the Irish, that'd be fine.
No problem. No, go for it.
No, Connor did a great job. You really have to listen to this, and then you'll really understand fats, proteins, and carbohydrates, and why we don't need those carbohydrates, and why we do need fat and protein. They're so important for our dogs. Okay, now we have something that is very important to talk about now. Sometimes when you switch a dog to raw, things don't always work out. Now, it may depend on the sort of raw you've switched the dog to, but I want to talk now, I'll get our wonderful speakers here to talk about a situation. We have a 7-year-old Labrador dog, you know, the dogs that just will eat all day till they expand and burst. That's the sort of dog we're talking about. Only ever been fed kibble, 7 years old. Now her owner is trying to switch her to raw, but suddenly has been switched to raw. She's showing the symptoms of inflammatory bowel disease. She'd been on the raw diet for 4 weeks. And this IBD, the inflammatory bowel disease, obviously is very distressing. And we're going to get each of our speakers to talk about their approach. How would they approach such a problem if they were confronted with it by an owner of a dog and they've been recommending raw? So first, Katie, how would you approach this problem in a dog who had been switched to raw food and been fed kibble all her life and now is developing these terrible symptoms of inflammatory bowel disease?
Yeah, so first off, I hesitate to call it IBD because typically it's like an autoimmune condition that's a longer lasting. So if this dog's never had symptoms of GI issues prior to this, I wouldn't necessarily label it as IBD. It's probably more of like a gastroenteritis or a GI upset because of the change in diet. So the first thing that I always look at when I have a patient that comes to me where we are transitioning the diet and this happens is, number one, we know that on a kibble diet, the microbiome is not appropriate, right? We're not going to have a good, probably a good balance of good bacteria. We have an overgrowth of bad bacteria. We have a dysbiosis present from that dog being on a high carbohydrate diet its entire life. So over here in the States, like if people want to learn, like, does my dog have an upset microbiome? There are tests that you can do to help distinguish that. So you can always run that at any time. I work with a lot of people that love having like the tools and the knowledge and what's going on internally. So that's always a route, but you don't have to go down that route. But this is where I'll see GI upset because now we're switching to a high protein diet. Maybe the fat content is too high potentially, and that's created GI upset. But the way I approach that is, we don't necessarily need to run to the veterinarian. We don't necessarily need to go to the ER clinic and spend a ton of money if the dog is still bright, alert, doing well, still interested in food, has good energy levels. What we need to do is I step to like fasting that dog for 12 to 24 hours using like a bone broth, adding in things like slippery elm, which is very soothing to an irritated GI lining, or even using marshmallow root if you can't find slippery elm. But both of those are pretty available no matter where you are in the world, giving that gut a rest. And then what you can do is you can either restart the raw food diet, making sure that we are feeding an appropriate raw food diet, using bland proteins like turkey. I'll start with a lightly cooked turkey just because in case that energetically was too cold for that dog, because I work off of food therapy principles, adding in some like cooked sweet potato to add in some fiber, some extra nutrients to help calm everything down and get that stool back to normal. And then we start that slower transition over back to the raw food diet, making sure I'm adding in things like probiotics, digestive enzymes to help support continuing some of that slippery elm, possibly like plantain also, to help soothe the gut, provide good prebiotics to the microbiome and help them through that transition. Because I feel like every animal can get to a whole food diet. Sometimes we have to do a little bit of a lightly cooked food. So that's where, you know, if your pet's not tolerating raw, don't throw everything out, you know, don't throw the baby out with the water, right? Isn't that, or something like that. So, you know, fresh food. I probably screwed that up, right?
Just don't throw babies out.
Cats, not babies.
Throw the baby out with the bathwater.
Yeah, exactly.
That's it.
So that's how I would approach that. So, you know, I find a lot of times this is where, you know, you're transitioning and your dog develops diarrhea, you run to the veterinarian because of course, you know, no one likes dealing with diarrhea. It's not fun for anyone. And then this is where you go to the vet who's not familiar with raw or afraid of raw because they're not informed and educated about it. And then they scare the pet parent about feeding raw, and then you hesitate and you never go back. So I don't want that to happen to people here. There's a way to work through that. And that's typically how I work to help reestablish, reduce inflammation, help the microbiome, and then go through a slower transition using bland white meat proteins and help them get onto the food that works best for where their gut is at that state.
Beautiful. Thank you, Katie. Ronnie, I'm going to pose you with the same question. You've recommended raw to some person. They've been on the raw for 4 weeks after a lifetime eating kibble, and suddenly they ring you up or email you. Does anybody ring anybody these days? I'm not sure.
We still get calls.
Ronnie, they contact you and they say, Ronnie, what you told me was absolute rubbish. My dog now, for the first time, is showing signs of inflammatory bowel disease. What do I do? What's your answer?
So because I'm not a veterinarian, I do want to make sure that the dog is medically healthy. So my first step of approach is just making sure there are no parasites and protozoa actually present in the dog, because that could always give us a false narrative thinking that the diet change is causing these gastro issues when it could potentially be a parasite problem. And that could be picked up just in the environment, not from the food itself. So that's always a plan of approach. I just always want to make sure that that dog is medically healthy from that front. And then I do want to audit the food that we have switched the dog to. Naturally, when I recommend a transition plan, I do more on the lower fat side, higher fiber, because we're going from that high carbohydrate, high processed protein to very high protein, low processed food. And I don't want to encounter any additional gastro issues. But if that does occur with those recommendations, I then start to want to consider, is there any type of food intolerance occurring that could be causing gastro issues there? And I would recommend jumping towards maybe a different protein that we have not considered. I caution using the word novel protein or exotic protein, because I don't want pet parents to feel like they need to go jumping through all these hurdles to get these very fancy and expensive meats. I just want, in these particular situations, I try to encourage those clients to think of a protein that they can source that's reasonable within their budget, that their dog maybe not has consumed a large quantity of, and we go from there. In addition to, of course, making sure the gut biome is well and healthy. So doing the same tests that Dr. Katie had mentioned, getting some probiotics and digestive enzymes on board is also going to be my plan of approach with that.
Wow, thanks, Ronnie. Connor, you're over there in Ireland. Some Aussie bloke rings you up, says, mate, you recommend raw food. It's shocking. I've had my dog on raw for 4 weeks with your diet, mate. I think it's your diet. And it's got this terrible diarrhea. I think it's got inflammatory bowel disease. What are you going to do about it?
I would say that, first of all, like when you transition a dog from dry to raw, there can be a little bit of digestive upset. People get very entrenched on this. Do you change the dog very quickly overnight, or do you do it slowly over a few days? And really, I don't mind what way you do it, whatever works for you. But people are entrenched, as families splitting up over this question. But we polled 400 people on dogs first. Did you do it quickly and did you do it slowly? We had 200 in one camp, 200 in the other. And unbelievably, 10% of each group, okay, about 20 of the 200 in each group saw a little bit of digestive upset. So just even the as Katie was saying, like you have a biome set to eat this ultra processed, chemically preserved. I mean, you're chemically napalming the gut flora, high carbohydrate, very strange diet. And the dog has a certain gut flora ready for this food. And if you go pile in a whole heap of new protein that the dog has never seen before, I think that there can be a little bit of digestive upset. So that can happen, but for it to still be happening 4 weeks later, that is not normal. So yeah, make sure you've been to the vet, make sure there's nothing odd going on. I would echo what Katie says. I'd like a bit of fasting. I think if you've got a bad gut, it's not really time to be eating a big meal. So you can fast your dog for as long as you want, 12, 24 hours, absolutely, in an adult dog, no problem. Hard to do with some dogs for sure, but you know, a fast is a good idea. Dry them out a bit. And then broth is just wonderfully nutritious. It's like the tarmacadam for the road, you know, in the guts. It's got all the stuff that the gut needs to heal itself. There's a reason we eat chicken soup when we're sick. My mum was totally right on that. So broth is lovely. And I also, if the dog was bad, I would actually move to a little bit of a cooked meat as well. Any cooked meat, turkey's fantastic. But if the owner is very nervous and not, you know, a little bit kind of worried, I would say even like a tin of like Pacific salmon. We get these beautiful tins of salmon that's already cooked for them, and they just can make up oatmeal or porridge. And the reason I use oatmeal or porridge is because it's high in soluble fiber, and soluble fiber is the fiber that soaks up excess water. And carbs are so easy to digest. You know, dogs don't need a whole lot of carbs in their diet, but you can use them in certain situations, and this is one of them. So as Katie was using sweet potatoes, another good one, whatever. So a bit of meat, bit of carbs. I call that a diarrhea diet, just to soak up. And I'd pop a couple of things in. Katie's already said them. I use marshmallow. I'd use a probiotic. Canine probiotics are okay, but we're after talking to a gut flora specialist, and she was comparing canine and human probiotics. Very, very similar. But I mean, very similar, because the dogs are different at an anaerobic level. So it turns out they're not completely different products. But anyway, a probiotic is fantastic. And then I would edge them back on. And if I'm on turkey and porridge or turkey and sweet, I would move them onto turkey, and I would move slowly through the protein, slowly back over to the raw diet. And I'd have a think. Yeah, I'd be reluctant to use IBD as well. Like Katie said, I'd be thinking, what's upset this dog's gut? Not all raw is the same. Some person's chicken can be okay, and the other person's intensively reared chicken might upset the dog's gut. So we slowly move through our proteins then, and just to make sure the dog's okay on turkey. Good. Okay. How are you on lamb? Good. How are you on beef? He gets gut issues. Okay. So I'd spend a couple of weeks on each one just for the first while to make sure we haven't bumped into something. And I'd tell them to make sure they check their suppliers and make sure that the meat smells good to them. You know, not all food is equal. So I'd think about the suppliers as well, just in case.
Wow. Now, everybody out there, you've heard 3 magnificent answers. This is probably one of the biggest things that happens when people want to switch to raw. And they immediately end up, a lot of them, going to the vet. And of course, as has been mentioned, the vet, of course, knowing nothing about raw, steers them away and back to kibble and back to the original diet. We don't want that. So you've heard, I hope you're listening, and please attend the summit with an open mind to all of this, because raw, it can cause, like any switch to any diet can cause problems, but there are ways around it. And the important word there out of all of this is diagnosis. What is actually going on? That's what we need to know. What is going on? We need a diagnosis, and every one of our speakers has touched on this and then touched on ways to go about reintroducing raw if it's been a problem, and why it's been a problem. So please don't let any bowel upset when you switch to raw turn you off. And I know if you live in a small apartment and you have a dog living there with you, if you switch to raw and you've got diarrhea, that is most unpleasant. So there were some tips too there about how you should go about it, whether you go about it slowly or whether you go about it quickly. But whichever way you do go, there is likely to be problems. So be ready and expect them. But I would say listen to those 3 answers again and again, because they were absolutely brilliant from all of our speakers. So I thank you for your knowledge and passing it on so brilliantly to our people out there. Now, our next topic, we actually have touched on it briefly. I think Katie touched on it briefly, but it's feeding bones to growing dogs, and it's the importance of this. Why are bones? And if you've read or noticed my books way back in the early 90s, the first book I wrote was called Give Your Dog a Bone. There was a reason for that. So we're going to ask our speakers now to talk about why bones are important for growing puppies, and a little bit about how you would feed them. So each of our speakers will now talk about bones for growing puppies. And so I'm going to start off with, we'll go backwards, because that's fairly Irish, isn't it?
Ian Billinghurst.
So Carter, could you talk about this?
No problem. Yeah, this is a lovely topic. So look, okay, first of all, they're just fabulous nutrition. They're vital nutrition for dogs. Bones are a crucial part of a dog's diet, okay? They've got bone crunching teeth, those big carnasal teeth that side down beside each other at the back, designed for eating meat on the bone and cartilage and gristle. They love a bit of it. But fresh calcium is the calcium you need in your diet. Studies show, particularly in humans, that calcium supplements pale in comparison to fresh calcium. Large populations of women were studied with osteoporosis, where they ate many, many times their RDA of calcium from calcium supplements, and then other people just got their calcium from the diet. And the people that got their calcium from the diet, even though they're eating significantly less, they were much better from when they were doing bone measurements, just half a year later. So we know fresh minerals is the way we want them, because in nature they're chelated, and the gut membrane likes the fresh minerals. The gut membranes don't like inorganic elements, so they don't like calcium and phosphorus and zinc. It needs to come in a certain way to the gut membrane, and that's fresh. So fresh calcium, absolutely pivotal to their health. As we all know, to our kids, it's one of the biggest, most important ingredients. We don't know exactly how much dogs need, which is strange. We have minimums and we have maximums based on the supplements they use in pet food. But providing your dog a meaty bone gives him all the calcium he needs, and he'll eat that bone. And it's not just calcium. there's all sorts of other nutrients in there like glucosamine, chondroitin, collagen, glucagon, glutathione, hyaluronic acid. You know, these are all things that the industry cuts out of dry food. And when your Labrador is walking around at 7, 8 years old, like a coffee table with some joint issues, then they give them the building blocks in a tablet sold to you at a book tablet. It's like, why did you cut those building blocks out? You're supposed to get them every day in your diet. And they're not just bonus extras in an orthopedic diet. So there's so many nutrients in bones, it's ridiculous. And also the teeth cleaning potential, as I'm sure someone else is going to talk about. Like, they have to keep those teeth clean. They're teething these little puppy teeth. Then they've got 42 adult teeth coming down at 5 months. Like, that's agony. And they need to chew, as opposed to chewing your table leg and other things that you hold precious. Why not be munching on a lovely meaty bone? It's just so nutritious. They cost you nothing. They keep your teeth clean, keep them away from the dentist. I mean, there's just so many benefits to bones, and they love them. So why wouldn't you? So yes, that's my bit.
Thank you, Connor. So true and so simple. Ronnie, can you talk about this topic of raw meaty bones for young dogs?
Yes, so I'm actually currently living that life right now with a 12-week-old 15-pound puppy. And I believe that giving raw meaty bones, not only on a nutritional level, is excellent, but on a behavioral and enrichment level, it is also excellent. We could give dogs the ability to chew and get that dopamine release, those nice, good, feel-good hormones in the brain, and that promotes really good feelings for the dog. That's some good enrichment that you will never be able to achieve with ground food or even with dry dog food. It's just that's never going to occur. So as a dog trainer, that excites me because I could use food to enrich my dog's life as well as nourish. So I'm hitting at it from 3 different angles. The thing that I do encourage pet parents to realize with puppies feeding raw meaty bones is that we do need to be a little strategic about what we do select because of their development of their mouth and teeth, because we do not want to feed a puppy with puppy teeth the same bones we would feed an adult dog. We don't want to damage those teeth, but we still want to give them soft bones that they can develop that jaw strength that they can crush and consume and safely digest those bones without risking breaking any of those teeth, which would inadvertently cause some bad feelings about food, as well as causing any types of internal blockages, because normally those larger bones are not very digestible for especially very young, small puppies. So very lightweight bones for our younger dogs with the baby teeth, but once those premolars and molars come in after that 6-month mark, that the door of opportunities opens there, especially if you have medium to large breed dogs. You could give those bigger bones, and I say bigger bones with caution. I do not recommend recreational bones that could cause slap fractures, but you could give things that are not these super soft bones like the chicken carcasses and things of that nature. So I'm a big fan of bones for many reasons, and that's my take on feeding bones to puppies.
Great, thanks, Ronnie. Katie, last but definitely not least, can I have your take on raw meaty bones for growing puppies?
Yeah, so I'll take the vet approach side too, but I love what Connor and Ronnie already said. You know, your bones, this comes down to a lot of the problems with processed food diets where we have synthetic vitamins and minerals. And when we use whole food in our diets, especially those raw meaty bones, we're getting that right ratio of minerals and vitamins in that. And there's some studies Dr. Jean Dodge shared in her nutrigenomics book where for feeding things that are processed like bone meal, it's higher in fluoride, and it can actually increase the risk of osteosarcoma or bone cancer later on in dogs' lives. So that's just another reason to like, how can we get like whole fresh foods into our dogs' diets? So important, especially at a young age. So I also, the enrichment side is huge. We had a German Shepherd puppy that we had a few years back, and they have a need. They need to chew on things. They have that prey drive, right? And if we don't fulfill that need, this is where you have those behavior issues that Ronnie was alluding to, and Connor mentioned also, where they'll start eating your shoes, they'll chew on that, they'll destroy like door frames, things like that's a natural instinct for them. And I love what Ronnie said with, the neurotransmitters and the endorphins and the chemicals that are actually produced from the puppy or the dog chewing on a bone is so important, especially when we live in such a stressful world and environment right now. If we can help our dogs produce natural endorphins and help calm themselves naturally, that's amazing and so powerful. The one thing I also want to say too, I know you mentioned, we keep saying raw meaty bones, and I think that's needs to be really, really emphasized, because so many pet parents walk into pet food stores and what do you see right in front of you? You see those processed bones, those, where they're cooked or, they're baked. And these are the ones that are heavily processed, and they have things like formaldehyde in them and chemicals. And those are the ones that are more likely to cause fractures. They're too big. They're not ideal for your pets. The other piece to this is where you don't like cook a chicken and then give them the carcass after it's been cooked, because that's going to cause splintering and cause those health issues. And then you go to the vet and they say bones are really bad. That's what we see as veterinarians, is we see those cooked bones that the dog ate and now they have an obstruction or there was a splintering or something went wrong because the bone that was fed wasn't an appropriate bone. So it's really important, those raw meaty bones. We have the gristle around the bone itself that's helping to keep the dog safe and chew. And I love, Connor, I think it's in your book, the hassle factor and all of that for the gums and the dental health are really important. And what Ronnie already mentioned with using appropriately sized bones and softer bones too for our growing puppies until they get to an appropriate age for those larger bones and more dense bones.
Thank you so much, Katie. Thank you, all of you. Raw meaty bones, they are almost in themselves, so long as they are raw, they're from a young animal, so they're soft and they're cartilage covered and they have meat with them and they're full of marrow. They're almost a complete and balanced diet for your dog, particularly when combined with a healthy microbiome that produces a lot of the vitamins that may not be present in that food. And then, of course, you feed the rest of the diet, which is based on evolutionary norms, and you have an absolutely biologically complete and balanced diet. But the basis of a healthy diet for a dog is that raw, meaty bone. I can't emphasize that enough. And our three speakers today have given you so many good reasons to understand that, which is absolutely brilliant. And I just, it's wonderful to hear, for me, as a veterinarian who grew up in an age where, and I've been watching over the last 30 or 40 years, veterinarians become more and more against raw food to a large degree, as they are trained by the pet food companies, to hear this wonderful understanding of the value of raw meaty bones. Absolutely fabulous. Now, can we get, I think we have to close. I think we're going to be running out of time. I know the people who have watched you now realize the depth and the brilliance of this summit. What you're going to hear is information you won't get anywhere else. Absolutely brilliant. So I'm going to ask each of you now just to give me one final tip on raw feeding that you'd like to share with our other party goers this morning. Let's start with Ronnie. Ronnie, could you tell us, what would you say is your most important tip to the people out there who'll be watching this summit?
My most favorite saying, and I find myself repeating it over and over and over again, is don't fear feeding food.
Yeah,
absolutely. Feed food.
Yeah, food, fresh food. Yep.
Yes, it's so important. That's what we should be feeding. And instead we feed this synthetic rubbish, which is actually stock feed. And that's terrible, to feed our important family members with stock feed. Katie, could I ask you for your important tip to our people out there?
I think a lot of people I see come with a lot of fear around raw feeding. And I always say start small. And if that means using a pre-made raw diet so that there's less fear around screwing it up, do that. If it means starting to use raw meaty bones, for your puppy or your dog, start there. Start with something that seems easy and doable, and then just continue to grow your knowledge and start implementing it. And you will see your dog improve its health, and it'll also give you like strength and help you get through that fear. And you'll realize it's the best way possible for helping your dog.
Brilliant, brilliant. Dr. Connor, what's your tip for our people out there?
Yeah, I like the reducing the fear a bit. It looks like we're all in agreement, really. It's all about people are very worried. There's a lot of money being spent to keep you worried and think that the science on the front of that packet is giving your dog everything. But the studies do not support that at all. There is no studies to support the use of these foods when compared to a real food diet. When you're asking someone that has looked at the studies more than most people, I would say that there is a very few head-to-heads of dry and fresh and real fed dogs, raw fed, fresh fed, whatever the term you want to use. There's really only 4 or 5 head-to-heads, and all of them have come down on the side of using real food. There is virtually nothing in support of this dry food over a real food diet. So the science is not in support of these products. The science is in support of using real food as it is in every other animal on the planet, and reduce the fear. As Katie was saying, as you increase real things in the bowl, oh, I can add in an egg. Oh my God, he can have a little bit of this. And as the real things add into the bowl, the fear decreases. You know, we all come out with babies from the hospital and we're handed this little thing. And once she comes off, mum, nobody tells me how to feed her. You know, my kid has stopped eating green things. And I'm like, you know, eat the vegetables. And she won't eat them. And she's going to do fine, you know. So we don't know their RDA of zinc or calcium, haven't a clue. And you think your dog is more technical than a baby, more important, you know. So that the fear is there for a reason. It's been put into you for a reason. But as both of them said very eloquently, you just you slowly start dipping your toe, and the fear will evaporate, and suddenly you'll look back and go, how did I ever fall for that? It's an incredible job they've done. It's an incredible lesson for us all that this dupe is going on, but nothing replaces real food, as Ronnie said in 4 short, perfect words, you know.
One of the things, actually, I wanted to interject really quick. One of the things I always tell people, because it's fascinating, like what Connor was just saying, is that we get so stuck that we have to feed a processed food, and if we stray away from that, we're gonna really cause harm. And you know, it comes down, there's all sorts of reasons, the money and all of that. But think about it, just like Connor said, if you took this newborn baby and you went to your pediatrician and you sat down with them and asked, what do I need to feed them? And they pop down a bag of cereal like Cheerios, and they're like, just feed this for every day, for every meal, for the rest of your kid's life, they'll do just fine. You'd look at them like they were crazy, right? And if you don't, you need to like reassess and learn more about nutrition. But that's exactly what we've been trained as veterinarians to do. And so it's absolutely crazy that we think feeding a processed food every single meal of our pet's entire life is going to help achieve optimal health. So keep that in like the back of your mind, as you know, pet parents, as you're going through this summit, because just think about fresh food is so important for everything.
Yeah, it's fun and they love it. It's so easy, you know. A handful of
I mean, the ease is right. It's convenient.
It's great fun. It's easy, you know. It really is. But anyway.
Look, how do I summarize this? I think you've done it, Katie, Connor, Ronnie. You've all done a brilliant job. Feed food, and don't be afraid of it. And my God, you don't need an Excel spreadsheet to raise your kids. And you don't need an Excel spreadsheet to raise your dogs. Feed food, and don't worry, if you feed the right food as evolution dictates, then all those nutrients just naturally follow. It's so simple, it's so easy. Don't be afraid, but be prepared to come to this summit now and learn this and get it drilled into you. And this is so important. And we have beautiful people like our 3 guests here today, or our 3 party goers, every one of them without a single drink in hand, giving you such wonderful information. And I've just got water, so I'm fairly with it as well. But this summit is going to be fabulous. So let's see you there. And I'm looking forward to it. It is going to be fabulous. So thank you all very much today. And here endeth the party.
Absolutely.
Thank you.
Thanks for having us, Ian.
Yeah, thanks, Ian.
Thanks for having me.
It's a pleasure.